How can you manage high superficial spreading melanoma costs? When facing superficial spreading melanoma, understanding how to manage the costs involved can make a big difference. Starting with early detection is key. If you catch melanoma early, usually at stage 1, treatment is often simple and affordable. Surgery to remove the melanoma is the main approach and is usually done as an outpatient procedure. This means fewer hospital stays and lower costs. Early diagnosis also means a very high chance of cure, which reduces the need for expensive treatments later on. The 5-year survival rate for early-stage superficial spreading melanoma exceeds 99%, making early detection both medically and financially beneficial. If the melanoma is caught early, the main expense is the surgery itself. This typically involves removing the lesion and some surrounding tissue, which can cost a few hundred to a couple of $1,000s depending on the location and healthcare system. Insurance often covers most of this cost if you have good coverage. For more advanced stages, additional treatments like immunotherapy or targeted therapy may be needed. These treatments are more costly, sometimes running into tens of thousands of dollars. It's important to discuss these options with your healthcare provider and explore insurance coverage or patient assistance programs to help manage expenses. Costs tend to rise sharply as melanoma advances. For stage 3 or for melanoma, treatments become more intensive, often involving systemic therapies and longer hospital stays. This can significantly increase costs, sometimes reaching over $50,000 or more. That's why early detection not only improves health outcomes but also helps keep costs manageable. To help reduce financial burden, patients should review their insurance plans carefully. Many insurance policies cover melanoma treatments, but understanding deductibles, co-pays, and coverage limits is crucial. Some pharmaceutical companies and nonprofit organizations offer assistance programs that can help cover expensive medications like immunotherapies. When appropriate, participating in clinical trials can also be a cost-effective way to access cutting-edge treatments while reducing expenses. Preventive measures are also vital. Regular skin checks and sun protection can prevent melanoma from developing or catching it early. Wearing sunscreen, protective clothing, and avoiding peak sun hours can help maintain healthy skin and reduce the risk of costly treatments later. Educating yourself and others about skin cancer signs encourages early action, which is often less expensive and more effective. In summary, managing high superficial spreading melanoma costs involves early detection, choosing the most appropriate and cost-effective treatments, utilizing insurance and assistance programs, and practicing good skin health. Working closely with your healthcare team can help you develop a plan that balances effective care with financial considerations. Remember, timely medical advice and preventive steps are your best tools to keep both your health and your wallet in good shape.